The Integrated Medicines Management Service from Pharmacy is a patient-centred care model which follows a patient from the point of admission through the clinical decisions that are made as an inpatient to discharge.
When patients come first through the door, within 24 hours we aim to see every single patient, and we perform what we call medicines reconciliation. So that's ensuring that we know not just the pharmacy staff but also any medics that everybody knows what the patient was taking prior to admission. We then review all medicines, stopping anything inappropriately and ensuring anything new commenced, such as things like antibiotics, are appropriate for the patient.
We also find out if the patient has any allergies, and we also find out how patients take their medications at home, because the GP could be telling the patient to take it one way, and the patient could be taking it a completely different way to what's been prescribed by them. So it's just to get an accurate medication history from the patient.
Also, while doing medication history, I construct a care plan, and I also do a clinical review to check whether their medication is appropriate or whether they've been prescribed as the patient normally takes, just to see how, appropriate it is, and also discuss with the doctors wherever there's any discrepancy.
On few occasions, patients asked me, I'm taking 6 tablets, but usually I'm taking 12. Am I getting all medication right? So you try to understand if medication is being missed off or is medication being stopped, because it's very important to the patient to make sure we're taking right medication on time and we're not worried about it. While patients are getting transferred from one ward to another ward, we place medication to the green bags, so that is safe to transfer them between the wards and can be easily identified. By each bedside it is a white locker where we're keeping all patients' medication. Each week, medicine management technicians is doing the check, making sure that medication what is placed in the white locker are correct, the doses are right, the labels are right, and it's supplied for the right patient.
Pharmacists lead the discharge process here at Sunderland Royal Hospital, so we make sure that we compare what the patient's taken before they've come in and what the patients are going home on.
So on discharge, when patient is ready to go home, we supply patients with new medication, is what is being prescribed while patient being in a hospital, and also we return the medication what patient brought home from home, just making sure what all medication is correctly labeled, and once patient's going home, we know what exactly they're doing.
We'll liaise with the community pharmacist just to ensure there is a flow of information from hospital to community and to the GP as well, and we would also advise the GP wherever appropriate. So if the patient has started a new medication, we'll let them know, and if they need any monitoring done from the GP, would also advise them regarding the monitoring, when it should be done and what type of monitoring should be done and why. So we provide all that kind of information just to ensure safety and quality for the patients as well.
The aims of the Integrated Medicines Management Service are to ensure that all patients receive the right drug at the right dose at the right time, to prepare medication ready for discharge to reduce the amount of time patients have to wait for their medication, to improve patients' knowledge of their medication and improve communication with GPs about any changes that have occurred during an inpatient stay, and also to promote the safe and cost-effective use of medicines.